Hi, my name is Mike. I recently underwent heart surgery. I had an aorta valve replacement and a single bypass. I wanted to do this video, or possibly a series of videos, to hopefully it'll help other people prepare for their surgery and to know what to expect. I had done some research prior to having my surgery done, and it was quite helpful, I believe, to me in my recovery. Basically, I was healthy going into the surgery. I was quite active still. Up to the end of January, I was still climbing trees and doing quite a bit of work. Also, I had a good attitude about having the surgery, and with the with the research that I did, I think it helped me prepare mentally for the operation and the recovery. I believe those were all instrumental in my quick recovery. Back in 2007, I had gone to the emergency room. I was having angina, chest pains, and they did some research and didn't really find anything other than a high cholesterol at that time. They didn't mention anything about clogged arteries or things of that nature. Several months ago, I became eligible for supplemental security income, as my condition, I have problems with my back and hips, and so I became eligible for disability under supplemental security income, and that's when I started seeing the doctor. Was able to get coverage from Medicare, and they had noticed that a heart murmur, and investigated it and realized that my aorta valve was bad. Also, that there was some restriction in the arteries from my heart, so, which warranted bypass. In preparation for having the surgery, they requested that I have dental work done. Over the years, I had lost a lot of my teeth, most of them anyway. Starting about the mid-90s, I had an injury. I was hit in the face with some lumber, and it loosened my front teeth, and I don't know if that was the onset of some type of reaction to that, but every year or so I would lose a tooth. Back in October, I had the remaining 12 teeth removed. Their concern is that bacteria from the tooth would attack and affect the the function of the new valve. I opted for a bovine valve over a mechanical valve because of the required blood thinners with the mechanical valve. I didn't want to have to rely on the availability of blood thinners given the political and economic climate. Also in preparation, I was a light smoker. I smoke a pipe, and they're probably the equivalent to a pack of cigarettes a week. Actually, I had quit one day before my surgery, which seemed to help a little bit. I wasn't hacking and coughing all the time. Like I say, I was a light smoker in that respect. I think in preparation, they have you do breathing exercises where you take in as much air as possible, hold it, blow it out as quickly as possible, and continue to blow until there's no air left in your lungs. And they want you to do this like 10 times per hour, which would be every 6 minutes if you did it on a regular interval. And they wanted you to practice this prior to recovering from your surgery. It's intended to lessen the chance of pneumonia. Also with the when they split your breastbone, it's quite painful to take deep breaths, coughing, laughing, anything that puts pressure on the breastbone post-surgery is pretty painful. My surgery was February 18th. I was released from the hospital on the 23rd. They were very happy with my progress and recovery. Basically, I was a poster child for fast recovery. The day after surgery, I was already walking the floors in the hospital. They had a 1,000-foot course that I would go through. And I think I went through it twice the first day, 3 times the second, 4 times the third day. I probably could have done more, but I would have been pushing myself pretty hard.